Good morning, everyone, and welcome to our virtual house call webinar on COVID-19 related mental health concerns. This webinar is brought to you by the New Jersey chapter of the American Academy of Pediatrics and the New Jersey Pediatric Residency Advocacy Collaborative, with funding provided by the American Academy of Pediatrics, the Nicholson Foundation, and the Horizon Foundation. My name is Brittany Johnson. I'm a Senior Program Manager here at NJAAP, and I'll be moderating our virtual house call today. We are recording this webinar and plan to share the recording via email later today, and we'll also make it available on our NJAAP website. To minimize any disruptions, all lines will be muted throughout the presentation, but we do encourage you to submit questions. At the conclusion of today's presentation, we'll host a Q&A period as time permits, so please share your questions through the Q&A box that's located on the webinar control panel, either at the top or bottom of your screen. I do also want to share this brief disclaimer before we get started. We know that new and updated information on COVID-19 is being shared on a near constant basis, so it is possible that some of the information we share on this call might become outdated. Given that, we would encourage everyone to take a look at the CDC and WHO websites for the most current and up-to-date information on the virus. With that, I would like to introduce our three speakers for today's webinar. Dr. Pai practices pediatrics at Eric B. Chandler Health Center, a federally qualified health center in New Brunswick, New Jersey. She's the founder and director of the Resident Education and Advocacy and Community Health Program at Rutgers Robert Wood Johnson Medical School and is a co-leader of NJ-PRAC. Dr. Traba is a pediatric hospitalist and the Pediatric Residency Program Director at Rutgers, New Jersey Medical School. In addition to her role in resident education, she is also the Interim Associate Dean for Education at NJMS, a district counselor with the NJAAP, and along with Dr. Pai is a co-leader of NJ-PRAC. Christine Lubis holds a master's in social work from Monmouth University and currently serves as the clinical program manager for the Pediatric Psychiatry Collaborative at Jersey Shore University Medical Center and St. Peter's University Hospital. In this role, Christine oversees the operations of several service locations of the program and works to expand grant opportunities which provide innovative pathways for service delivery and mental health resources to address unmet mental health needs for children across our state. And with that, it's my pleasure to turn the webinar over to Dr. Pai.
Good morning, everybody. So we're going to talk a little bit about how to talk to our children about COVID-19. I know with the Family Success Centers, that issue has come up very often. So just wanted to go through some of the ways that we can talk to our children and talk to the families that we serve through the Family Success Center. Brittany, I'm just having a little bit trouble. Sorry, guys, I'm just having some trouble with controlling the screens. Okay, here we go. All right, so like we said, so some of the things we'll be reviewing is just kind of how to talk to your children and how to give advice on talking to children, encouraging healthy habits, talking about routines, providing reassurance, coping, and how to keep our families and friends connected. So one of the things that we can talk about, oops, sorry. Brittany, do you mind just actually advancing the slides if that's okay?
Yep, not at all.
Great, thank you. So how do I talk to my child about COVID-19? So I'm sure many of you already done this and had this conversation with your children. So the most important thing is being calm and reassuring. So not only are they listening to what you're saying, but they're listening to how you're saying it. And, you know, as we all know, children are a lot more mature and smarter than we think sometimes. And they are listening to not just when you're talking to them, but also when you're talking to other people. And they hear everything. So just be very mindful when you are talking about COVID. And if you are talking about your own concerns, making sure that when you're having those conversations about your own anxiety you might be having, making sure that's happening in private. Because we don't want to relay those anxieties into our children as well. That being said, it's always really important to be available. So making that dedicated time to talk to your children, being aware that they have questions or they may have questions and that you are available and they can come talk to you and ask those questions. Another thing to think about is what they see on screens. Right now, we are, a very screen-driven society. But you really want to think about how much time that your children might be spending on screen, especially around topics such as COVID-19. Sometimes they're seeing things that are false, they may see rumors, and too much information on any topic can lead to anxiety. So really be careful about how much information that may be looking at in terms of COVID-19. And then you want to make sure you're providing accurate information, which is appropriate for the age and developmental level of the child. So that being said, I think about it in terms of my own family. So, I was talking to my sister-in-law about her 3-year-old son and how much information she's going to give him. She's not going to scare him and talk about, the infections and what happens after the infections, but he is seeing people with masks on. So she's talking about, just keeping people safe and that our families are safe, but we just want to make sure everyone's okay. Meanwhile, I talked to my brother about my 6-year-old nephew and how he talks to him about it. And for a 6-year-old, it's going to be a little different. And talking about that, why we need to stay inside and about social distancing and a little bit more details. But again, you don't need to talk about the number of deaths that are happening, how sick people are getting, but just talking about it so he understands why he's not going to school. And then finally, I think about it in terms of my 11-year-old and 14-year-old children. And talking about it in the sense that making sure, what are they looking at when they're on their screens? What kind of social media posts are they seeing that may be false about it? And answering questions as honestly as possible, but giving them reassurance as well. Next slide. So I like these 3 R's. So reassure, routines, and regulation skills. So when we're talking to our children, you want to make sure you tell them they are safe and their loved ones are safe. They need to hear that because it's scary when they see their family members in masks. It's scary when they go outside and they see everyone wearing masks or avoiding walking near them. And it is, but you want to tell them that they're safe, that you are safe, and that you're healthy, because children need that concrete reassurance. Routines. I'm not going to go too much in depth because Dr. Traba will be talking about this a little bit more, but routines is really the foundation for keeping that normalcy at home as much as possible. And I know in this time of this pandemic, it can be a little difficult, but from the beginning, we've heard our teachers and health professionals talking about the importance of maintaining a schedule. And that comes down to about sleep, eating, learning, and playing. Regulation skills. So you really want to be able to let children express themselves. Sometimes they may have their tantrums, more meltdowns than usual, but realize that where is this coming from? A lot of times we've seen children start regressing. So we're seeing some toddlers who start wetting their bed again. Older school-age children who may just have meltdowns for what seemingly might not be any known reason. But help them manage their difficult feelings and talk to them and understand that this is maybe because they have to be home all day. They're not seeing their friends. But also give this opportunity for children to ask questions about what they're feeling, how they're feeling, and let them be as honest as possible. Other things to consider are how to manage those difficult feelings. So if it could be some deep breathing or some quiet time or alone time, something they may need to let go of those feelings that they may be having. Next slide. And I think this is really important. Emphasize the positive. So, although we might see a lot of negativity in terms of feeling that we are isolated, that we don't see our friends or our family as much as we want, we don't get to do our sporting events, we don't get to go to school. I think the other thing is really important in terms of emphasizing the positive things that are happening during this time. So, for example, talk about stories of hope and resilience. So you see people who are leaving the hospital, the discharges that we are seeing from the hospital. I think even for us as adults, it's good to hear. So in our hospital at Rutgers Robert Wood Johnson in New Brunswick, every time a patient is discharged from the hospital, they play "Here Comes the Sun" over the loudspeakers. And it's important for us to see the positive work of the efforts that we're putting in. The other thing is for children to hear those stories too about people doing well. Also, I think the other part of it is seeing people helping one another. Talking about how you were seeing people going out in the community and helping get donations for food pantries or delivering groceries for their elderly neighbor. Or even for the older kids, talking about all their athletic heroes who might be starting relief funds and what they're doing with their money in terms of helping making sure the rest of their country is doing okay. And the other part of it is just emphasizing it more on just an individual level and your family level, that you're going to spend more time together as a family. So it's really important that you kind of are able to give this perspective to children and talking about the importance of providing the positive things that are coming out of this pandemic and helping allay the fears. Next slide. It's also a great opportunity to continue enforcing about the importance of hygiene and the spread of germs. So you want to use this COVID-19 pandemic as a context for talking about why it's important that we clean hands and the proper way to wash your hands. So the CDC has a lot of great information about it. I know there's a lot of songs that people put out there. So we usually say sing happy birthday, but there's other songs that you can make it more fun and creative, and the proper way to do it as well. And this habit that they're getting into, so making sure they're doing it for 20 seconds, but also about when they're coughing and they're sneezing, making sure they do it into their elbow and then they throw the tissues into the trash. And then also talking about the proper use of hand sanitizer when soap and water aren't available, how to use hand sanitizer. But just a reminder is making sure that you supervise the younger children when they do use hand sanitizer. Next slide. Social distancing. This one I find it a little bit more difficult when you're explaining it to children. Because one of my friends who's a psychologist recommends that we use the term physical distancing as opposed to social distancing. And I totally agree with that, because it is difficult for children to understand, especially like I mentioned, my nephew who's only 3 years old, and for him to understand what social distancing is. Why can't he go to school anymore? Why can't he see his friends anymore? For my 7-year-old nephew, why he'll never go to the end of his school year is already done. And it's really hard for children to understand that. And you have to understand that they're going through their own anxiety or depression symptoms because they just don't understand it. But I think it's important, depending on your developmental age of your child, to really explain it as much as possible. So when we talk about social distancing, it means just not going out unless it's absolutely necessary. So that means, for going to buy food or getting medical care and going for some exercise outside. And that should, only be alone or with members of the household. But talk about why that's important when we're talking about it in the context of schools and restaurants, stores, movie theaters, or even athletic outings, things like that, and why we can't do that. So it's important to explain those to children because sometimes it's very confusing for them this time. As confusing as it is for us as adults, you can just only imagine for children. And I think the other part of this is talking about not going to other people's homes and not having friends or even extended family over, which can be really difficult for children. So understand why we're doing that. And also maybe putting in the context, we're protecting our grandparents, we're protecting our aunts and uncles, we're protecting our friends too from getting sick. And then, as hard as this is in many areas, is not taking the public transportation. Next slide. So another question that comes up are which news sources are trusted information? So just as Brittany mentioned before, the CDC and the World Health Organization really provide the most up-to-date information and the most reliable and validated and scientifically proven research-based information. So I would recommend that whenever you have questions, especially for our children, when they have questions, one of the things to do is go to one of these sites and look it up together, especially depending on your age of your child. And a good way to kind of show how you might not know, but rather than make something up, go together and find out the answers. Also, the New Jersey Department of Health has done a great job. They have a COVID-19 dashboard, which I encourage you to look at too. And it's just a great way to see what's going on in your own community, your county, and the state as well for reliable information. Next slide. Another question that keeps coming up, what's the truth? So there has been some misinformation on social media, but how is coronavirus spread? So it is spread by droplets. So the droplets are larger size, so 5 to 10 micrometers in size, still very small. And the way it's spread is close contact. So as many of you already know this already, but just to reemphasize this, it's through coughing, sneezing, sometimes even talking. And those produce droplets, and those droplets then enter the other person's mouth, nose, or eyes. And that's how it's spread. It is not airborne, meaning it doesn't just stay in the air and then go from person to person. The only times we think about it becoming airborne is when you have specific procedures, invasive procedures, like intubations, where we put breathing tubes down someone's throat, if someone's needing CPR, or a procedure, a surgical procedure when you're putting a tube into someone's throat, making a hole in their throat to get into their breathing tube. Those are the times we think about it as airborne. But for the rest of us who, in the public, it's a droplet precaution. So that's why we're recommending that people wear masks, whether cloths or surgical masks. Next slide. Social connections. So this, I really feel like one of the most difficult things, I had to maintain it. So questions come up about how do we suggest to use screen time for children using electronics to connect with family or friends. So I found this one a difficult one to answer because as a pediatrician, we are always talking about screen time, limiting screen time, and how, toddlers shouldn't have any screen time. And, the older toddler is no more than an hour and a half. And then older children than school-age kids, no more than 2 hours of screen time. But I still recommend that we continue to monitor the screen time, but make it a fun way, make it a way to connect socially. So some of the examples, especially for the younger kids, is Pokemon Go. It's a great way to get children outside and use their phones to go on a mini scavenger hunt. And other ways you can do is a virtual play date. So in our own family, we've set up Zoom meetings where we play a simple board game. It's a great way for family members to see one another, especially for the children to see their other family members or their grandparents and just see that they're okay and that they're healthy. And a great way to connect. For some people, they're connecting more than they did before. FaceTime, WhatsApp, all the same ways to connect with people. And again, create a game. Make it a daily, like a weekly thing that, okay, every Sunday at 6 o'clock, we're going to have our family game night. And that means your family from all over the country, if that works for you all. And that's a great way for children to do some time together too. And I found, as I was doing research for this presentation, I found this hashtag quality time on Twitter is a great ideas to look into about how to spend quality time with family and friends. Next slide. The neighborhood scavenger hunt. So this is a really great way. I love this idea. A great way to go outside and connect with your community and your neighbors. It's basically a neighborhood game of I Spy. So people are putting rainbows in their windows. So the children draw rainbows, put them in their window, and then the children go outside and look for those rainbows. Some communities have Google Maps set up of the participating homes. But it's a great way to do that. It's a great way to, like I said, connect with neighbors. Other people are doing as a homemade make your own bingo presentation. So they'll create a bingo card saying find a bear or find in someone's window, or tulips. So a great way to, again, another type of scavenger hunt for the family to connect and be outside and get some fresh air and exercise. Next slide. Go outdoors. So really important. I emphasize this with all my patients and family members. Really important to go outside at least once a day. It is safe to go outside. You can wear a mask. It's a public health measure to protect yourself and protect others. As we know, all the playgrounds are closed. A lot of the parks are closed, but going outside onto the sidewalk or onto your road if it's not busy and taking a walk is a great way, not just for your physical health and getting your physical exercise, but for your mental health too. It's a great way to get vitamin D, which is also really important at this time. And again, you want to go places that are not crowded, and also being mindful if you're going to play sports, ball and equipment can be touched by someone else. When you have children from different households playing with one another, that is something to take into consideration. That is a way that the virus can spread as well. But it is very safe to run outside, walk outside, bike outside, and just connect with nature, which is really healthy. And it is safe to drive in your car as well with people from your own household. But as always important, as soon as you come in from being outside, wash your hands for 20 seconds. How do I help high-risk loved ones? So this is a really difficult one, especially for the elderly, who is a group that's already socially isolated many a times. But we want to make sure high-risk individuals such as elderly or immunosuppressed people should really avoid contact with children. Children, a lot of times we're finding that although they may be safe, even if they get infected, and we're finding that they are doing relatively well if they are infected with the COVID virus. However, sometimes they could have the virus and may not have symptoms or be asymptomatic, as we say. So those children, even though they may not have symptoms, they could still have the infection. And if they interact with their grandparents or a family member that is immunocompromised, they can pass it on. So it is still important, though, that we have those social connections. So what can we do to help these high-risk people in our families or our friends? Virtual visits, set up regular FaceTime calls with them, or just the old-fashioned way, set up a regular phone call with them. Help them out by sending care packages or doing their grocery shopping. So all good ways to maintain those social connections while still maintaining our physical distance. Next slide. This one, the question came up is, I lost a loved one during the COVID-19 outbreak. There are a lot of great resources for bereavement. There is the Sharing Network through New Jersey, which offers grief support. NJ211 is always a great resource for community resources, and I encourage you, everyone, to take a look at that. Not just as NJ211, not just as it offers support for bereavement, but for families suffering from food insecurity, having to pay their rent. A lot of great community resources on that site as well. Next slide. How can I find connections while I'm quarantined at home? So just going into a little bit more in depth here. So I think the most important thing is when you're feeling that loneliness that many people may feel. So they might be in a household full of people, but you can still feel lonely. So the first thing I encourage you to remember to ask your children is have them label what they're feeling. So if they're, like we talked earlier about families feeling or children feeling, having their meltdowns or just not feeling they don't know how to cope, but have them label, talk to them, have them, ask them what's going on. So saying that I feel alone right now, or I feel disconnected from my friends and family, it's a great starting point because it just identifies that uncertainty that you're feeling and why you're feeling that uncertainty or why you're feeling that sadness. The other thing is to remember why you're staying home right now. Sometimes we forget because we just feel like we get stuck in this rut and this day doing the same things day in, day out, and it can be difficult. But remember, thinking about it instead of, oh, I can't see anybody, I'm cutting off others, being cut off from others, focus on why you're doing this and have children remember they're doing, especially for the older children, but they're doing this to protect their older relatives or their relatives who may have some immunocompromise. So just a good way to remember why we're doing what we're doing. 3, move your body. This is so, so important. Exercise is really a good way for just, as I said, physical and mental health. But it could be anything, taking a walk outside, dancing by yourself, even if it means doing some spring cleaning, exercise classes. So there are a lot of great ones online for free too, but a great way to boost your mood. Doing something creative. So this is something that might be outside many of our comfort zones, but taking this opportunity to write in a journal, whether it's doing those coloring books, just taking pictures outside, learning a new instrument, coming up with some recipes, and encouraging children to do this, and as an adult doing it with them. So that way they feel like they're creating something, and it's a great new way to spend this extra time. And there has been research that shows that when people engage in these creative pursuits, it can actually help alleviate feelings of loneliness. So another great reason to do something creative. Next slide. Setting small goals. This is also really important too. So when you're trying to find these connections and this sense of like, what am I going to do? Coming up with some few very specific goals that you want to accomplish. And that's something that can be something as simple as I want to, cook twice a week. But it gives you that sense of accomplishment. Personally, I've set my goal as trying to run 10 miles a week, which is a really challenging goal for me. But it's something that every time I do it, I feel like, okay, I've accomplished something today or towards my bigger goal. But it gives you that purpose and meaning about what you can do to continue to stay healthy and mentally at peace. Eating nourishing food. So I'm not going to go too much in detail about this because Dr. Traub will be talking about this more. But you want to minimize your stress eating. It is easy to kind of say, oh, calories during COVID don't count. But you want to make sure you're still eating healthy. And there are foods, believe it or not, that can actually boost your mood, and try to pay attention to what those are. So believe it or not. So, well, we know vitamin D can be found in leafy greens, which are always great. A lot of almonds can contain nutrients that boost your mood, drinking plenty of water. I also did find that chocolate is one of those foods that can boost your happiness levels too. So that's always something to do. And there's also by eating healthy, we're going to boost our immune function and help protect us from getting the disease as well. Connecting with others. So I know I've talked about this before, but really important. And especially for those of us who this doesn't come naturally, but regularly scheduling videos or phone check-ins with your loved ones. And again, however you want to do it, whether it's a regular phone call, there's a lot of great sites out there, House Party, FaceTime, Zoom, Skype, but really make it an important priority. And you can make a list of people that you want to reach out to, that you should be reaching out to. It could be someone you haven't talked to for days, weeks, months, or even years, but this is the perfect time to make that connection. And make sure you put that in your schedule and make sure that children know that that's a regular part of what we're going to be doing. And even for those kids who don't feel like, they don't really like to talk on the phone. So have the kids set up a movie together, watch a movie together, whether it's sitting on the phone and watching that movie or even doing a workout together. But, even those few comments while they're watching the movie is a great way to connect. And realize and tell this to children too. You can, for the children who may be a little bit more reluctant to make those connections, that it's not just a benefit for them, but it's benefiting the person they're connecting with. And another great way to improve social connections. Next slide. And those feelings of loneliness can get sometimes to the point where it is important to reach out to a therapist. There are a lot of therapists that are available online through FaceTime or Zoom. So, and we're going to talk a little bit more about those resources, but really important to do that. Creating a routine and just having that schedule, that structure and predictability. And I think most importantly, remember, it may not seem like this, but the situation is temporary. There is an end in sight. There is a light at the end of the tunnel. And I know, as not just as adults, but it's important for children to know that this will be over soon. We might not know the exact date, but it will be over soon. We will be able to connect with our friends and family again and be able to go to stores and restaurants and most importantly to school and have those connections again. And it's important that we remind our children that, and the children that we work with, so they know that there is a light at the end of the tunnel.
Hi, everyone. We're going to move on to the creating and maintaining routines. I see. Oh, no. If I can get this going, 1 second. There we go, I think. Okay. So first thing is just talking about that struggle with balance and work. And trust me, I think we're all facing that. And so you are not alone. I think it's the biggest reassuring thing, hopefully. But I think it really depends if you have to work from home or if you are one of the essential employees that may need to be going in with that, homeschooling balance. So if you are working from home, and I know this may be easier said than done depending on your job, but really I think that open communication is the biggest help, really having that talk with your boss, being open about what the issues are, trying to problem solve with your boss in terms of how you can potentially restructure your schedule. Obviously being flexible with that, it may mean, certain hours of the day are restricted to your children and homeschooling, and then you may need to be flexible moving into other hours to do your work. And be realistic, right? So, I mean, you can see right now we're doing this all remotely and not having us on video. So while my kids aren't in the background right now, they were for our last session, right? So, use that mode. If you have to do video calls and so forth, you can have the option to turn off that video or mute as before you're talking, knowing the children are in the background. I think honestly it causes more stress to us as individuals, whereas I really do believe people on the outside are much more forgiving of those things because, for the most part, there are many facing the same situations. So honestly, I'd say just don't be so hard on yourself and being realistic. Again, hopefully if you can keep that communication open with your boss and trying to be as flexible as possible. If you are an essential employee and you need to go into work, I think this is one of the most challenging things for the homeschooling component. don't be afraid to reach out to your kids' teachers. I know depending on the age, some may be more independent or flexible work, while others, you know, they may need to be calling in with their teacher and you may need to be there more present with them. But understandably, if you have a relative or babysitter or someone else taking care of your child while you're at work, they may not have the wherewithal to actually, you know, do the homeschooling, the component you need to do. So don't be afraid to communicate with the teachers and really ask for flexibility in terms of submitting those assignments, and kind of, it may require restructuring the day a bit to accommodate. But please know you are not alone. I think teachers themselves are facing the same issue, right? Because they're trying to do the remote learning for the kids in their classes as well as their own children at home. So again, don't be hard on yourself. Don't be afraid to ask for help or reach out or ask for flexibility within that. Honestly, I think this is something that everyone is facing with our kids. How can you help them stay focused, right? This is huge. So I think number one thing, which is also maybe one of the harder things, is consistency, right? So setting that kind of routine or daily schedule. I know something that's been helpful for me with my own kids is they still have to go to bed the same time every night, even if school is at home and not in person. And they still wake up at the same time, have breakfast at the same time, and start school at the same time. Obviously, that's easier said than done if you are having to go into work and someone else is taking care of the kids. But if you're working from home, I would have that same schedule with the kids as well. Breaks are essential though, okay? Especially for the younger kids, maybe 20, 25 minutes tops is probably time for a break. I don't mean an hour break, which some of our kids probably want, but a 5-minute break, a get up and stretch, those kinds of things. If you have kids of multiple ages, don't be afraid to assign some tasks to the older kids. My children are about 3 years apart, but my older one is much more computer savvy, I'll say, has been able to help, you know, when I have to be at work and maybe my husband's home without me, they're able to help each other in terms of that. If that's not an option, you can also try to stagger the start time. So like have, okay, you know, 8 to 10, we're gonna focus on this child, and then 10 to 12, focus on the other child, and give more free time and kind of flip-flop that if you can. Again, I can't stress enough the breaks though. So what do you do during that time? Honestly, my kids had a jumping jack challenge, which was fun, and it was only 10 jumping jacks, but they all like videotaped each other and posted it to their school group. And they each had to do 10 jumping jacks and nominate someone else, right? So something simple like that. It doesn't mean you have to go outside, although you can go for a quick walk if you want. It may just be a water break. It could even be climbing the stairs. It could be a quick song. And I know that may sound silly, but it's a great way to just break up the day and like turn on a music, have a quick little dance with yourselves, and then move on to the next step. I will say though, you should avoid video games during the day because those are not quick breaks, right? They're getting on their devices. It's not gonna be a 5-minute break. So I think these are easier things to do. Healthy snacks, I think Shilpa had talked about a minute ago, I think are essential. So this is not the time to give the sugary drinks and sugary snacks because they're gonna get a peak and then drop and they're gonna be tired in about an hour or so. So water breaks, fruit if possible, or granola bars, more substantive snacks as opposed to just the sugary fast acting things like candy and so forth, will be much better. This is hard, I'll admit, because it gets frustrating, I know, at home. But listen to your kids. So if they're telling you they're getting frustrated or they're not understanding something, take a step back. That might actually be a time to take a 5-minute break and then readdress it and try to figure it out together, right? Or if they're telling you they're exhausted, you know, for whatever reason and they need a break, listen to them. That's okay. There can be a little bit more flexibility at home with those breaks in between. So again, listen to what they're telling you and try to adapt the day from there. So video games, like I said, and I know this may be easier said than done, but really trying to avoid video games and really screen time in general if you can during school hours. I know it's hard because they're all on their computers already, but again, if you have that dedicated time, if they're going off to watch a show, again, it's not gonna be a 5-minute break, it's gonna be much longer and they're gonna be much more resistant to coming back. One of the huge things is really setting expectations and limits. You may want to set a maximum amount of time or time frame when they can actually do their video games, but then you have to follow through, and that's hard, right? If you give in that 1 time, 2 times, 3 times, it's going to create a pattern. I thought this was great. There's all different kinds of ones on the internet about these video game contracts where you set like specific tasks they have to do before they can actually play the video games. This one even has it where they sign off on it. So you can do a multitude of things, and actually kids might get a kick out of this in terms of having that contract there that they can hold you accountable for as well. And honestly, you may need to set a timer. I know that sounds silly, but I know for my own kids, what they think is, like what I think is, too long versus theirs is very different, and they will lose track of time. They could be going 2 hours and not even realize it, and they think it's 10 minutes. So having an actual timer can actually be really helpful as well. This is kind of more COVID specific, but I think it has a lot of great points within it. So the structure, again, that creating that, it's kind of counterintuitive in one way, but really a consistent daily routine as much as possible, but at the same time having a level of flexibility, because yes, things are not normal right now, right? So keeping the routine as much as possible, but again, listening to your child and recognizing when maybe they just need a break, and that's okay. And you can build those in as well. This is huge, right? We are a model for our children's behavior, right? So not just in terms of social distancing, but really in everything we do. So if we start getting really agitated or anxious or start yelling, which admittedly we all are going to do at some point. So again, please don't be too hard on yourself, but those things are going to reflect in our kids, right? And they're going to see that and they're going to become more anxious and so forth. So trying to remain as calm as possible can be key. And I love this point. I think, at the end of the day, just take a minute to say something positive or fun, right? And, with your child, you can each say one positive thing about that day. It will reframe the whole, your whole recollection of that day, right? That's what then your child or you, right, are going to remember when you're going to bed, is that positive thing that you just discussed. All children misbehave at some time, right? So do adults, right? Who are we kidding? We all misbehave at some time. Especially when they're tired or hungry or anxious, they're gonna act out, right? So first things you can try redirecting, right? If they start getting restless or anxious early, can kind of take a little break there and maybe change the topic or change to something a little fun for a few minutes and switch back. Pausing, this I use a lot myself, I have to admit. Sometimes, like in my head, I want to just lose it and scream, and I just say, okay, you know what, I'll be back in a few seconds. Go to the other room and just start counting to 10 and breathe in and out. Can be a huge help. There has to be consequences, right? So if they're not able to be redirected after a pause, they're not regrouping, then there needs to be a consequence to their behavior. And it may be a multitude of things depending on your child. However, again, like we talked about in the last slide, please make sure you can follow through on it. So if you tell them, I'm going to take away your phone or your device for a month or a week even, right? And in reality, that's probably not going to happen. Do something either smaller time or more structured within that. So again, just getting into more of the nitty-gritty of a day routine. Just like you said, keeping that same wake-up time as they normally would for school is key. I know this is hard, especially when we're all limited in our own space at home. I would set aside, if you can, space, and I don't mean they need their own room, right? But it may be at your kitchen table, wherever it may be, just that they have their dedicated space. And it may just be a little square, it may be an invisible kind of wall there, but just have them maintaining their space for their work environment is huge. This you can do. I honestly haven't done this for my own kids. You could actually write out a schedule. But my husband did. He's much more organized than me. He actually created a table with like their chores and routines for the day, and then just has it posted up on the wall in our kitchen. You can definitely do that and then list the times. Definitely schedule times for snacks. if you can, obviously, if you have to go to work, this is going to be difficult, but as much as possible, having that dinner as a family, bringing everyone back together, and then again, sticking with your normal bedtime routines. This is an example from New York Times. This is very detailed. So I'm not saying that you have to get to this level with your own children, but it's just to give you an idea, right? And so the younger your children are, the more free time or flexible time you need, because the reality of them focusing from really more than 15 or 20 minutes is going to be very difficult. But again, think of other things you can do. And some of these can be you know, as simple as puzzles, reading a book together, sorting different shapes, and so forth. Also, though, remember the practical stuff. So chores can be integrated within the day, right? Having them clean up, having them help make the snacks depending on their ages, and or helping with their younger siblings as well. So moving on, focus a lot on sleep. My child's having trouble sleeping, what can you do? You'll see a lot of recurrent themes through this. I think, again, the routine part of going to bed and waking up at the same time every day is really huge, and it reflects in everything. So not just their own sleep, but also how they learn or how they'll interact and their mood for the day. So sleep is huge. Avoiding caffeine consumption in general, but definitely later in the afternoon or evening. Obviously, the younger kids, we don't recommend caffeine really at all or very little, but for the adolescents and so forth, they should be restricting, especially in the late afternoon as well. Bright light in the morning. So I know you may not be able to go outside, but if you can, open windows or open the blinds and really have that sun shining through as much as possible. When the room itself, when a child is ready to go to sleep, you need to make sure that it's dark, right? So studies have shown bright light will keep you awake, right? Hence the bright light in the morning. It needs to be relatively quiet, right? And they also recommend keeping the room cool as opposed to, you know, a warmer environment. Not going to bed hungry is huge, but also you don't want to have a big heavy meal right before you go to bed, or you'll likely have some stomach upset and so forth. So, you know, but a small meal, something with protein in it, as opposed to like a sugary meal right before bed would be helpful. Develop a routine. You know, it may be, I think that our National Academy for Pediatrics recommends something called the 3 Bs, which are brush, book, and bed. So brush your teeth, read a book, and go to bed. But simple things like that, or even like a simple, quiet song, and so forth can be helpful. The bedroom, as much as possible, should be only used for sleeping. So what do I mean by that? They shouldn't be going to quote, sleep or their bed with their electronic devices. If at all possible, we actually recommend don't even have them charging the devices in their room because they may start using them, but actually keep it separate and have it, like even have it in a separate room charging so they're not tempted to go back on their devices from there. Exercising regularly is huge, but do it during the day, and this is for the kids, have them very active, and adults as well, can actually have them sleep better at night. And then, of course, this may be harder to enforce, but the pets in the bedroom, I'll leave that for your own decisions. This I get asked about a lot, melatonin. For those, if you haven't heard of it, it's basically it's a natural hormone-like substance that's released at night, and it tells the body it's time to sleep. It's not really a sleeping pill, so to speak, but it is used in the community to help adjust with sleep. Now, it is not regulated or approved by the Food and Drug Administration, or what's called the FDA. It is an over-the-counter medication. So with all over-the-counter medications, I think you really should discuss with your own pediatrician first. There's not great, a lot of evidence or research behind it. However, it does appear that the short-term use is probably safe. However, if you're using it for months on end, it's less clear. We just don't have enough research yet. The most common side effects with it tend to be sleepy when they're waking up, or drowsy, or being sleepy overall during the day, and urinating more overnight. And some have also said headaches as well. So we always recommend the behavior changes first. So what we talked about, all that structure and routine. If you feel like that's still not working, I would talk to your pediatrician, and you may consider a short-term use of it, say over a few weeks, just to get help, if it does help you get into a sleep pattern for the kids. What if I'm really scared and it keeps me up at night? I have a poor immune system and keep thinking of worst case scenarios. And I think this is reflective of many of us in the community, including ourselves as pediatricians, right? This is a time that really none of us have lived through before. And so I think it's really important to look for other ways to relieve some of that stress. And I think Dr. Pai went through some of this earlier as well. But in addition, all of the sleep tips that we just talked about for kids really do apply for adults as well. Just a couple other things to keep in mind. Avoiding alcohol a few hours before bedtime, also avoiding any nicotine, smoking, vaping, and so forth, at least for several hours before bedtime. Some believe like a warm cup of tea or a glass of milk before bedtime could be reassuring. Again, avoiding the lights when you're trying to sleep. Definitely can read a book. Some like the relaxing music or the sounds of like waterfalls and so forth to help with that. I know this is hard, but really we set the example for our kids as well, but it also helps for your sleep. So if you can wake up and go to bed at the same time, it will help get your sleep into a better routine as well. A warm bath or shower before bed could be helpful. So exercise during the day is wonderful, but you don't want to exercise too close to your bedtime. So if you can, stop at least 2 hours, if not some say 3 to 4 hours before bedtime, can help as well. Really, in terms of the stress, I think Dr. Pai alluded to this before, but really the journaling, right? And you don't have to have some big fancy journal or the leather bound or anything, right? Even like those old school, I still use mine, the marble composition, like for $1 notebooks that you probably send your kids to school with. Even something like that, it doesn't have to be like a real, so to speak, journal, but something where you just jot down your thoughts, especially for those of you that may be at home and it's just you and your kids, right? And you feel like you don't have an adult to talk to. So even just writing out your thoughts can be really soothing, especially if it's at night when I think, when your kids fall asleep and you're the only one left awake and you have no one to talk to and you're in bed, that's a great time to write it out in a journal and really be able to reflect on what your concerns are and kind of just let it all out and give you a really good relief before, and hopefully will help also calm you in terms of sleeping as well. So again, you don't need to buy some fancy journal, just a basic old, cheap notebook for $1 can do the trick as well. So some suggestions for activity or exercise without contacting other people. And I think Dr. Pai went through some of these as well with great, like the rainbow connection and so forth. I'll say, there's many things you can do indoors too. Obviously, under your direction, I won't tell this to their kids, but the dance parties are awesome, right? So whether it just be you and your kids, or if you want to do through, Zoom or FaceTime and do it with, integrating other people in your family or friends. Balloon ball, my kids love this, but I will say be mindful of what's around you. But balloon ball is just what it sounds like blowing up a basic balloon because it's less likely to break stuff and kind of, passing it around within the room. Other movement-based games, so like charades, there's a lot of online kids fitness videos. There's like these cool yoga and meditation ones too. So all different kinds of activities. If you are gonna go outside, which is totally fine, even a family walk. My kids get really excited for this still. They're 9 and 12, and they think it's the best thing in the world to just go for a walk with us and come back. Bike riding, obviously, but depending where you live, that may not be the best option. I know for me, for where I live in the city, it's a little bit more difficult. Of course, using a helmet if you need to. And then just your basic throwing catch, right, or balls. Make up your own games. I know my kids just made up a ball game. Outside they call it trouble ball. My last name is Traba, so I laugh because they're all like in trouble. It's really basically football tossed back and forth, but they think it's fun and they made up their own rules and they think it's really fun. They literally just go outside the house, nothing except a small like Nerf football, like so it's on the softer side, and they'll do that for an hour or two and think it's the best thing. I love this life sock ball game. So even if you don't have a ball, it's just like fold up a pair of socks, and you can use more socks if you want to make it a little bit bigger. Obviously clear the room you're in for anything breakable. And then you can do it either as soccer or basketball or bowling, depending what you want to do, or just playing catch. But I thought this was awesome. And I think for kids, they love stuff like this, where it's so simple. You don't need anything else other than the socks in your house. And you can use that for some activities. Old school hopscotch, right? Like, so if you have some old chalk in your house and you can make it on the sidewalk, that's really cool as well. This is just a picture of the balloon ball I was talking about. And of course, I've seen a lot of people hosting these virtual dance parties, which can be cool as well. If you don't want to go that tech savvy though, just have your own dance party in the house. So what are some stress reducing activities for you as a parent? And again, I know we've been stressing this, but I can't stress it enough. Number one thing is go easy on yourself. This is not a contest. It's not the time to go for, you know, the parent of the year kind of thing. We are all trying to get by. Everyone is making exceptions, and we're trying to be flexible with our kids. So really go easy on yourself. You are doing an amazing job. Just keep thinking back, you know, this is a time like no other, and we are all going to get through this. And it doesn't matter how you get through it, you're going to get through it. And so just give yourself some slack. The sleep hygiene, you know, we talked about a lot. I think Dr. Pai alluded to this too, but really, if you can limit how often you're checking the news or social media, I know this is really hard, especially when we're all on our cell phones or other devices the most of the day, but really try to limit that as much as possible. And obviously you can stay in touch with friends through video chat. And then the journaling, like we talked about before, and of course, the fitness classes, keeping active is huge. Okay, I'm gonna hand over to Chrissy.
Thank you so much. So now we're going to start discussing anxiety, how to manage the anxiety that you're feeling or that your child's feeling, and just some techniques to kind of stay present and stay calm during these crazy times. Okay, so one of the questions that we do get a lot is that, you know, parents are struggling with COVID-19 themselves, with homeschooling, work, caring for relatives, worrying about everybody. So the question is, how can I manage my anxiety and avoid passing it to the family? So a lot of what we already talked about, you know, partake in self-care and restorative activities. So whatever that means for you, whether it's, you know, taking a rest, reading, exercising, mindfulness, even just spending a little extra 5 minutes in the shower or a bath can be really grounding for some people. Remember to prioritize the important things. Just because, you know, we're stuck at home doesn't mean that it's a time to stop celebrating any highlights, whether it's milestones, birthdays, anniversaries. Make sure to still keep that as part of your routine. We did discuss the positive social connections, which is, you know, connecting with friends and families, and, you know, seek professional help if you're struggling with very high levels of stress. There's a lot of telehealth services available or video conferencing, which has made mental health care really more accessible to everybody. What are some signs or changes in behaviors that signal my child or teen may be struggling with anxiety? So changes emotionally or behaviorally are absolutely expected during this time. It's how children and adults react to trauma. And that's really what we're in. We're in a period of a shared traumatic experience. So it is normal to be seeing some changes. But depending on your child's age, you may be seeing them struggle with nightmares and trouble sleeping, excessive focus or hyper focus on certain stressors. There's the increased aggression or irritability, Regressive behaviors, you may see that your younger child is now regressing into, childlike behaviors, whether it be bedwetting or any toileting accidents. You may be seeing some self-harming behaviors, reassurance seeking, so making sure that everything's going to be okay and consistently asking you as a parent, are we okay? Are we safe? Reluctance to separate from you. Physical symptoms like a headache or a stomach ache may be happening. That is a big sign of anxiety. Avoiding school-related tasks and excessive crying. What should I do if my child is showing signs of anxiety? So the one big thing that we really, really can't stress enough is talking to your kids about how they're feeling and exactly what's going on. Earlier in the presentation, we shared, how to kind of make sure that you're sharing age-appropriate information. So, your child of 5 should not be receiving the same information as your 12-year-old. They're just not able to handle it in the right ways. So, children adjust better when they feel like there is a sensitive, caring adult in their life, whether it's this pandemic or not. They tend to adjust better to things when they do feel supported and safe with somebody in their lives. There's also, for the younger kids, there's also an option of creating a feelings chart or a traffic light. So having a red dot, an orange or yellow dot, and a green dot, and kind of defining what each of them means. So, a red dot could be, I'm feeling anxious, overwhelmed, and like I want to cry. The green dot could be, I feel absolutely fine. And then if you just Google feelings chart online, there is a lot of feelings or a lot of material out there where the children can actually point to the way that they're feeling. If they can't express themselves, they can identify more with a face showing that emotion that they're feeling. We did touch base on how to create a schedule and really try to stick to it. And we also talked about the regulation. So making sure that children are working on how to manage their anxiety. They definitely could benefit from some deep breathing, exercising and movement, and even some quiet time. On YouTube, there is a lot of wonderful guided meditations, they're called, for children, and it kind of helps them move through their anxiety, build their safe space, and channel their energy a little bit differently to be more calm. We did discuss the virtual play dates and how to stay connected. There's also being creative. So they're actually doing a lot of the museums across the country, and zoos are doing virtual tours, which is a wonderful way to get your kids excited and make them feel like they're still connected in the world in some way. Emphasize the positives and model positive behavior. Regardless of the pandemic, children learn how to handle emotions, and they learn how to handle situations from their parents and other models in their lives. So making sure that we are modeling the way we want our children to behave and the way we want our children to be able to manage some of this stuff. And then also spending undistracted family time. So no TV, no electronics, no, anything stimulating the kids, really bringing them down to your level, whether it be cooking together, baking together, doing a family dinner, or like we mentioned before, reading before bed, spending that extra special time together where it's just the two of you and it's really undistracted. How can I cope with anxiety that I will catch it and give it to an elderly family member? The media is a wonderful thing, but it can also be very overwhelming. So we're definitely recommending that you stick to trustworthy sources like the CDC and the World Health Organization. Your public, your police departments, fire departments, first aid departments are also a good resource for accurate information. Limit how much you're checking. So it really shouldn't be for more than a half hour a day. You just get the updates and then you do step away from the media. Be careful what you're sharing with your elderly family members and being very informed of what you're talking about, what you are sharing before actually discussing it. Helping others makes us feel good. It feels good to give back. It feels good to, donate to your food banks. Be a calming influence in your elderly's lives and really reach out to them and make sure that they are doing okay during this time and just be a voice that they can speak with. You can also focus on what you can do, what you can solve, these concrete things, and what you can control. So we can all control how much we're washing our hands. Some of us can control how much we're staying home, going out for only the essential trips, and also avoid touching your face. How do I help my loved one who is suffering from intense anxiety? So these are some tips of how to kind of coach somebody else who's struggling with their mental health problems. So you want to listen non-judgmentally and express concern. We're asking, how are you feeling? How long have you been feeling this way for? And you're paying attention and you're showing that you do care. Give reassurance and validation. So we want to reassure them that it's appropriate that they're feeling the fear, the sadness, or the anxiety. Now this is not to be confused with saying, oh, well, everyone's feeling that way. It's to say, hey, you know what, this is really scary what we're going through, and it's absolutely normal that you're feeling fear and sadness. So it's kind of reassuring them that it's really appropriate to be feeling the way that they're feeling. We're going to encourage self-help and other support strategies. So that can be found with family, friends, or your faith communities. And also encourage appropriate professional help. So like we said before, there are the video conferencing services that are available. Doctors, therapists, psychiatrists, they're all available on video conferencing. And hopefully we'll have time to get to some of those resources. So these are a list of activities. I know we went through a lot of them that we can do to distract yourself, keep yourself free of anxiety. So it goes through a lot of, baking, cooking, taking up a new hobby, completing that project that we've all been putting off for so long, really having the time to do that, whether it's organizing or doing a project on the house or the garden. And one that I really like is make an appreciation list of all the things that we are really blessed to have in our lives, whether it just be something as simple as our health, the home that we're able to stay in. We practicing that gratitude every day really sets the tone for the day and also going into your next day. How can I stay mentally healthy as someone with existing anxiety and mental health conditions? One of the biggest things that, therapists and social workers and any mental health professional really like to encourage people to do is challenge your irrational thoughts and replace them with facts. So if we're saying, oh, this virus is everywhere, I'm definitely going to get it, we can reframe that thought by saying there is a risk that I could catch the virus, but if I take the recommended precautions, then I will significantly decrease my risk. There is, again, professionals, mental health professionals that you can visit who have helped in the past. Staying connected to your support system and practicing those relaxation activities for at least 5 minutes. There are some resources, but I am looking at the time and I'm knowing that we are a little bit past 11 o'clock. So I believe Brittany is able to send them out to everybody. I don't know, Brittany, if you wanted to go through some of them or if you wanted to email them out.
Yeah, thank you, Chrissy. So what we'll do, I think, in the interest of time, just so that we have maybe a minute or two to take a couple of questions, we'll send these resources out to all of you following the presentation today. Some of them are resources that we've shared in the past presentation, just some of the basic ones, right? So we had shared on the Early Childhood Development Action Network resources that they have for kids. SPAN is offering these really wonderful 30-minute family talk chats twice a week on Tuesdays, both at 11:30 a.m. and 7:30 p.m. It's a great opportunity for you to join and just be able to have some open and honest conversations about challenges that you might be experiencing, about school closures, so on and so forth. We also have some of these kind of more broad resources on mental health that Dr. Pai was able to share in our last presentation, but since they were still related here, we wanted to just share those once again. And we had also mentioned that 211 has some resources in the last presentation. They also have a page of resources that's really specific to mental health, and they have a lot of really, really great contact information for a whole slew of programs that are offered in each of the 21 counties across our state. So I'll make sure that I share this with all of you. There's a directory of mental health services by county that the Department of Human Services puts out that has some great information in it. The Mental Health Association of New Jersey also has a mental health cares helpline for folks. If you want to dial into that, they do have a TTY line and translation services are available. And then we also have the PPC, which works in collaboration with pediatricians' offices. Grief services, like Dr. Pye had mentioned earlier, will send out information on those, as well as some information that the National Alliance on Mental Illness has put together. I'll share links to these parenting posters as well so that you can take a peek. Dr. Traba was kind of talking through a couple of these about structure and dealing with kids who may be misbehaving. But at this time, I'd like to take just a minute or two to address some of the questions that have come in. If you do have any additional questions, you can type those into the question box that's either located at the top or bottom of your screen. And Dr. Pye, thanks so much. I know that you were answering some of the questions that were coming in through the chat box throughout the presentation. So I'm just taking a look here.
Yeah, in regards to the virtual zoos, I'm happy to share that link with you, Brittany, if you're able to send that out to them. Is that easiest?
That would be fantastic. That would be great. Thanks, Chrissy.
Yep.
And I see another question in here asking about the PowerPoint. Yes, so the slides for the PowerPoint, the actual recording of this presentation will be shared with everyone later this afternoon in that same email where we will share links to all of those resources as well. And we have another question here, Dr. Pye, if I can direct this one to you perhaps. Somebody asked, how do parents go about disinfecting, especially with children?
So this can be a challenge sometimes, especially with younger children. So one of the things I'd recommend is that always carrying around a portable hand sanitizer if possible, especially when you're going outside and after they're touching something, making sure they sanitize their hands right away. Because we do talk about once, with their hands, especially not touching your face, your eyes, or nose, which is even especially more difficult in children. So using hand sanitizer whenever you're out in public with your children would be great. But again, you want to do it in a calming way, because sometimes we can be saying, start yelling at our children if they start touching their face or their mouth or things like that. But just making it a part of routine that after you touch something, you use a hand sanitizer. And then when you go back inside, washing your hands. And maybe a good idea also in your home to kind of get in the habit of disinfecting. So at the end of the day, for example, I'll just take Lysol sprays and disinfect our entire, whatever is touched more frequently. So in my last presentation, we talked about really the hard surfaces and commonly touched areas. So faucets, doorknobs, chairs, countertops in the kitchen, for example, bathroom faucets, bathroom doorknobs. So those are the areas that we'll just wash down quickly at the end of the night, just to make sure that we keep our house as clean as possible.
That's great. Thanks so much, Dr. Pye. And I'm not seeing any other questions at this point in time. So looking at the time, I just want to say, on behalf of the New Jersey Pediatric Residency Advocacy Collaborative, as well as NJAAP, I want to extend a warm thank you to our panel, Dr. Pye, Dr. Traba, and Chrissy for sharing their time and expertise with us today, as well as all of our participants on the line for taking the time to attend today's virtual house call. Like I mentioned before, you can expect to receive an email with a link to the recording of this session, as well as all of those resources that we mentioned later this afternoon. Our next virtual house call is scheduled for next Tuesday, April 28th, again from 10 to 11 a.m. And additional details and a registration link on that are forthcoming. We'll get that information out to you all either later today or tomorrow. So thanks so much for joining us today. We're wishing all of you a safe and healthy week, and this concludes our webinar. Thanks so much.